diagnosis means that we can basically, diagnose the preconditions which precede myeloma. We know that everyone with myeloma basically had molecular gammopathy of unknown significance, previously MGUS, and if we can detect patients at this stage or with small B myeloma, we may, at some point, provide therapies which would prevent progression to myeloma, thereby prevent organ damage, kidney dysfunction, anemia, bone disease, and hopefully may even cure some of these patients. Yeah. Late diagnosis, as I've just said, is associated with organ damage. So if we want to prevent it and improve quality of life and potentially cure patients, it's better to diagnose it earlier. So there are two main prospective studies which are looking at it at the moment. The PROMISE US study that we are taking part in, and also the Icelandic study, the iStop-MM study, which is the largest one and included almost 75,000 screened patients. And the incidence of MGUS is about 4.4 to 5%. And I think it's quite impressive, and we also know that the incidence increases with age. And I think that these studies are paving the way to define who are the population at risk to implement this screening test. The PROMISE study, as opposed to the Icelandic study, which screened everyone who is 40 years and older, the PROMISE study looked only at patients who have higher risk, which means first-degree family members of people with myeloma or Afro-Americans. Both populations are known to have higher risk to develop myeloma. And they have also implemented a new technology for identifying the monoclonal protein. And the results are very impressive, demonstrating that basically, there is a quite high number of people who are having, monoclonal protein in their blood, which may precede at some point the development of myeloma. So I think it's highly important. I think that we have to learn. We don't know yet how to use all these findings. But I think that, having a prospective study that will tell us who are really at high risk to develop myeloma and who just have monoclonal protein in his blood, but it's not going to progress to anything, it's going to help us decide how to follow up these patients, what should we do, and at some point, take these patients who have a true high risk of progressing to myeloma into clinical studies and hopefully, even treat them outside clinical studies at some point. But we don't have the data yet. I think that basically, that we should all together try and define the criteria. Who are the subpopulations that should be screened? What are the screening tests that should be implemented? And work together in order to find out, people who have a high risk to develop myeloma and screen them, detect it early and prevent organ damage and hopefully cure them. But I think it should be a joint work because it's going to be quite difficult to convince authorities to implement tests, and especially if we don't really define who are the people that should be screened.